Hey guys, Chelsea here with Tribe RN, and we're talking with Tiffany today about correctional nursing. A little bit different time difference than we normally do it, so hopefully more of you are able to view. So hi Tiffany, thanks for joining us.
Hi everybody.
So you guys were super interested in correctional nursing. You guys entered a ton of questions. If you have more questions as we're talking, please go ahead and enter them, and I'll ask Tiffany as they kind of fit the conversation. So what did you do prior, and how did it prepare you for correctional nursing?
So my first position as a nurse was actually emergency room. So I got quite a few years of ER experience and then I did correctional nursing as a PRN position while I was working in surgical services and getting my nurse practitioner's degree. So I started basically straight after my time in the ER, which was about 4 years. That was my first time doing correctional nursing. And now I work within corrections as a nurse practitioner, so I'm still there.
Okay. So what led you down that path? What made you even turn to correctional nursing?
Truthfully, I don't think anybody ever says, I'm going to be a corrections nurse or a prison nurse. And I can tell you, I never in a million years thought I would be there. For me at the time, it was something that was extremely close to home. And it was a way for me to shifts here and there, and I ended up falling in love with it. It's a very different type of medicine, of nursing, than anything you could practice in a hospital, in a urgent care, in a clinic. The population that we serve is one that typically has not had a lot of outside care. So when we get them, in a sense, they're a lot of times train wrecks, but it's the most challenging but rewarding type of nursing I've truly ever done.
That's awesome. Thank you for doing that type of nursing, because you're right. I definitely would not see myself as a correctional nurse. Some of the viewers have said hello, so hi to those who are joining us.
Hello, everybody.
Yeah. Is this a good place for a new grad to start? And if it isn't, where is a good place for them to go to get experience prior to doing corrections?
We have had in the past few years a couple of new grads start, and truthfully, I would not suggest it as a new grad. Because these patients typically have not had a lot of care prior to entering, the penal system, and it doesn't matter really whatever state you're in, you have to be ready to handle 1,000 situations, from alcohol withdrawal to benzo withdrawal to seizures, DKA. There's so many things when these guys get to us that they have to do. Now, the facility that I particularly work at, we are the largest one in my state. And with that, we have a hospital unit, an inpatient hospital unit, where we can do IV antibiotics, suction, we do hospice care, post-surgical, we have physical therapy, we have speech therapy, we take care of everything in the world there that comes out of the hospital. We also have the state's only inpatient psychiatric hospital. So we have psych on site. I run the geriatric unit, so we have a full-blown geriatric unit complete with walkers and wheelchairs and scooters and things that you wouldn't expect you would have little old men in prison, but you do. So with all of that, there's so many facets that you need to basically hone skills. Any med-surg unit would be fine. ER, you pretty much just need to have some good background, at least a couple of years, in my opinion, just because our facility and most of the facilities can take you in so many directions. The other part of this is many, if not most, of our patients are pretty intense IV drug users. You have got to have great IV skills, blood drawing skills, those kinds of things. If not, you're never going to get blood from our little turnips that we have. So any you can pretty much do anywhere, but just you really need to have a couple years of at least one solid year, depending on where you're at, of good experience underneath you. All our new grads have struggled, really, really struggled.
So a couple questions. One came in from a viewer. Do you work in a prison or a jail?
I work in a prison.
Okay. Sorry, go ahead.
There's a little bit of a difference, although I have done some moonlighting in a jail. From the nursing perspective, it's very, very similar. We do meds. We do something called sick call, meaning the inmates or the prisoners put in a request saying, hey, I want to see medical for whatever reason. It can be something as little as I want to cut my toenails, because prisoners are not allowed to have toenail clippers on their person. They could be dangerous, mainly to each other, not so much to staff or medical. But sorry guys. But meds and sick call are the main things. The one difference I have seen is there tends to be a lot more detoxing that goes on. So there are at times a lot more acute patients that happen there. Most of the time those get sent off to the hospital fairly quickly, but you do get some pretty intense withdrawal at jail.
Lots of comments coming in. Let's see. Emily says, I agree with the experience. I started as at a jail as a new nurse, left corrections, did 4 years med surg before coming back to corrections. Well, I'm glad that you came back, Emily. That's awesome. And then another question, Molly says, can you explain how hospice works in a prison? And my question kind of coincides with that. Do all prisons have some sort of medical units, or is yours just specialized?
No, in my state, every state facility has some degree of medical. That does vary. Our facility has what we call 24-hour medical, meaning that in each unit we have multiple nurses, techs on 7 days a week, 24 hours a day. But there are other facilities throughout the state where we send some of our healthier patients. They have no medications. If they have anything, it's something simple like Tylenol or ibuprofen. It's, nothing major.
Okay.
And we would have medical there 5 days a week, Monday through Friday, 8 to 5. So that decision actually does ultimately lay on the providers that are there, nurse practitioners or doctors, to determine what their level of illness is and where is going to be best to suit them.
Okay.
Hospice in our state is unique. We are the only hospice facility in the entire state. We don't have an actual hospice team that comes in. I guess technically, if we're getting real technical, they call us more palliative care.
Okay.
Same thing for the most part. We do any regular end-of-life care, morphines, the Ativans, anything that a normal hospice team would do, we can pretty much do. One thing that's very interesting is we actually are very accommodating to families. We don't let them stay with them, usually while they're actively passing. I think it happens once or twice here and there, but we try and let the families come in and visit as many times as possible towards the very end so that they can see them. My facility actually also has a seminary program for other inmates who are trying to reform their lives, and we have quite a few recidivism programs, and that's one of them. When we know somebody is truly getting close, these other inmates will come and sit with them, so we never let anybody pass alone.
Oh, that's nice.
Always be with them.
I like that. I'm glad to hear that. Let's see, no new questions from the tribe at this point, so we'll move on to our list. We haven't gotten very far so far. So what are the hours like?
So fairly flexible, since there's so many different entities within, for instance, our facility. The majority of my nurses or LPNs, we do lots of LPNs as well, and I know that's something that's kind of fading out in a lot of hospitals, but in corrections, we're still use them quite a bit. My main nursing staff works 6 to 6. Most everybody works 12-hour shifts. There are other ones that work 10 to 10, just to kind of give us some overlap. So we do have a little bit of leeway depending on which unit you're working in. We also have most of the administrative staff for our facility is all nursing, all the way up to our head boss, other than one medical director. Everything else is nursing. All nurse practitioners, all directors of nursing are all BSN or MSN prepared, and then our health services administrator is a nurse. So, we're very heavy on the nursing, which makes it great because they understand what we're going through.
Yeah. And question from a viewer: what's the most difficult thing clinically that you face in your position? Yeah.
As a provider, probably the hardest thing that I face is a lot of times these patients see the newest, latest, greatest on TV. And well, that's all fun and dandy. Even when I was a provider on the streets, and I'm sure most of you know, going through a prior auth process for some of this stuff is ridiculous, even if you want something. We have the same type of process that happens within corrections. And that is, let's say I think somebody needs to go see a general surgeon. I still have to do basically a prior auth request. Okay. And sometimes, at the end of the day, this is our taxpayer dollars at work for the medications, for all the offsites. So I'm trying to be fair. If it's something that I know a patient needs, I'm going to do it. But if they've had something that they could have easily sought treatment for, prior to being incarcerated, it's like, well, is this a real emergency or not? I think the biggest thing is trying to help the patients to understand that just because they're in prison, they don't get everything that they want.
So I read the question as more clinically, like, what skills are you having to utilize? And make sure, Amber, if I'm wrong, please correct me, but I think your question was more clinically in terms of your skills set.
Skills wise, it's always a challenge just because these guys have not taken care of themselves for so many years. Trying to get them as a whole to get where they need to be. Going to bed? Night, baby. I'll be there in a while. Sorry, guys.
No, beautiful. It's great.
If you don't, I think this kind of goes back to, how much experience do you need? If you don't have those baseline skills to really be able to assess patients, that's probably your biggest challenge, making sure you have that, because these guys have no idea what's even wrong with them 90% of the time. And then being able to work in a situation where most prison facilities are not ACLS certified. I am ACLS certified, but that would take on a whole new set of certifications for the prison system. So, agency, you have to be able to rely on your basic clinical skills in order to assess, treat, especially your night shift, because there isn't a doctor on. We're on call.
Another question that was entered prior to is, what kind of backup do you have in a clinical emergency? So if someone was coding, what does that look like for you?
The entire correctional staff is CPR trained. We have AEDs there, but basically it's, stabilize to the best of your ability with the AED if needed, and call 911. Like at my facility, even on a night shift, there's at minimum, spread throughout the facility, there's about 8 to 10 nurses on, or techs.
For how many people?
Our facility has about 900 inmates right now. Yeah.
Okay.
Mm-hmm. And where we're at, we're spread out. So like for my unit, we have 280, and at night there's 2 nurses and a tech on.
Wow.
But there's always going to be the correctional staff who are there, and everybody's CPR trained. And the biggest thing is then you call 911. Just because that would open up, when we don't have a doctor there 24/7, it really opens up a whole separate set of liabilities in order for us to be ACLS certified.
Sure.
And
So
that adjusting when I first came out of the hospital, that
Yeah.
was one of the hardest things I had to adjust to.
yeah, I can't wrap my mind around it. So I guess my next question is, what exactly, you have 200 and something patients amongst 2 nurses. What's your day look like? What does that look like? What are you doing? Obviously, you don't have to tend to every single one of those patients. So what do you do? What does that look like?
So the biggest things are distributing medications. A lot of our medications are what we call DOT, direct observation therapy,
Okay.
psych meds, very minimal narcotics, certain heart medications, Coumadins, things like that. So the typical nursing day starts out at 6. They go in, they get report, start working on triaging all of the sick calls from the day.
Mm-hmm.
Some of them are simple. I want to see the eye doctor. We fax it over to the eye clinic. We have an on-site eye clinic, on-site dental, those kinds of things. And then Medline. Medline usually takes an hour. That usually wraps up everything's good and done by about 8 o'clock. Then we start clinic. The nursing staff will see sick calls one at a time for cold and flu or, little things. If it gets to be too much, then they either ask me to see them right away or they put them on the schedule to see me.
I'm just going to ask the people that have joined in late. She's now a nurse practitioner. So she was just standard nurse and like the rest of us in corrections. And now she's gotten her nurse practitioner and went back to corrections. So that's where she's speaking.
Yes. Nursing sick call usually goes until about 11 o'clock. And then we go into lockdown. Multiple times a day, the Department of Corrections does a formal lockdown where they do standing counts of the inmates. So our lockdown usually lasts for at least an hour to an hour and a half. And that's when we have lunch. Inmates don't bother us. We get a lunch. It's fantastic. We usually don't start back up again until 1 o'clock. The nursing staff will do more sick calls if there's anybody that's coming in from work. Every inmate works.
Okay.
It's even my 81-year-old little guy who's in a wheelchair, he at least dusts doorknobs. But we have kitchen workers and industries workers and lots of things. So they'll finish that up and then they do orders for a lot of the afternoon. About 4 o'clock in the afternoon, we run diabetic Medline. We separate ours out into diabetic and non-diabetic. And then that'll usually take them into wrapping things up, and the new nurses come on at 6 p.m.
Okay.
It's nothing like running a 12-hour shift in the ER. It's much more relaxed. There's times when, we've got a nurse and they've got a sick kiddo, and we've got things under control enough that they can run and pick their sick kiddo up, take them home, and come back.
Wow.
We're much more relaxed and in that aspect.
So a few more questions coming through. I don't know that we're going to be able to get all of this covered in 30 minutes. Tiffany, so Emily says, in my jail, we have to use security with us whenever we interact with patients. We are not defense trained. Did you receive defense training, or do you also need security with you?
We have security with us, and this is actually something new that they are getting the rest. They're going to start training here within the next month, all of us on defensive tactics. And that's going to be all non-security staff. So it'll be basic, but that is truly, I have 5 years, and at no given point have I ever felt the need to have to physically defend myself. I have an amazing security team around me. I truly feel safer working in prison than I ever did working in the ER or when I was doing primary clinic.
Yeah.
I've got such a great rapport with my security staff that I can literally look at them and they have that inmate out in 5 seconds. And that's a lot.
Yeah.
And in my world, no means no means no. And if I tell them no and they need to leave, they know that they better get out and leave. So, but yes, I will very soon have defensive tactics, but we have security with us all the time.
Okay. And then another question, let's see, Molly asked, could you describe the setting in which you see the patients? Like, are they in their rooms when you see them?
No, we actually have full clinics. We have a room it's quite large. We have 3 exam tables. I have a full office set up, and I have there are security cameras that are above so they can always see what's going on in there just for security's sake. But then we have some additional exam tables. My nurses can utilize those for any exams that they need to do. Most of our sick calls, the nursing sick calls, they do exams by exemption. So if it's a sore throat, they're going to listen to lungs and heart, look in the throat, things like that. But they don't have to do a full-blown assessment for everything. So they don't always need to utilize those extra rooms. But yeah, we have it's a full clinic. Just like you pretty much, it's all in one room, but it's pretty much no different than you would go to a doctor's office in.
Very cool. That's really interesting. So are there any specific certifications to prison nursing? And if you took that certification, how did you prepare?
So that's actually something that's very up and coming. They are working on the American Association of Correctional Nursing is working on a full national certification for that right now. I was told that it was hoping to be done by 2018, but I haven't seen anything on that. So I don't really know where they're going with that, but hopefully I'll see something pretty quick on that. But it is definitely something that's in the works.
That's awesome. That's great. And what are the top 3 challenges in prison nursing or correctional nursing? What is the correct terminology so I can just call it the right thing?
Either one.
Good.
I guess technically it's correctional, but top 3 challenges. Wow. Lockdown is probably number 1. And at the end of the day, security trumps everything. And so if they have a reason for us to be in lockdown, then we are in lockdown. And that means that day, unless it's truly a life or death emergency, nobody gets seen at all. Which, hey, that gives us a day to catch up on paperwork and charting, but it's really nice to get those days every once in a while. The second thing is probably, and this is both nursing and from a provider, it's both. We do so much education, but these guys, a lot of them have not gone past the 8th or 10th grade. And so that's a huge challenge, is getting them to understand, making them understand, they have diabetes. This is what we need to do. These are the things that need to be done. These are things you can do in prison to help with that. I think the educational aspect, both from what they're coming in from the streets with, we call it the streets, and trying to get them at a place where we can teach them. That's always a huge, huge challenge. And I think the third one is truly, and this is both on both sides of it, it's overcoming their sense of entitlement. A lot of people have never been told in their life. And a lot of times that's why they end up in prison. But making sure that they understand that just because you want something doesn't mean you always get it. And those are probably the biggest fights that we have with inmates, as in they get angry because they want something. That's probably the biggest challenge. Once they understand and they've been in there for a little bit, they understand, but it just takes a while.
Yeah, that makes sense. So what do you think makes a good nurse in your area in terms of characteristics that creates a strong prison nurse?
You have to be strong clinically, very strong clinically, but you also have to have a strong personality. And and this is nothing against other types of nursing, because we all know we each have our own cup of tea. Me, for instance, I could never work in labor and delivery. Praise God for all the L&D and nursery type nurses. But we had an L&D nurse come try, work with us. And she said this absolutely, she could not go from being loving and tender and caring with brand new babies and brand new mommies to needing to be firm, firm, and consistent with every single inmate. You have to have that ability to be fair, firm, and consistent. Put your foot down. No is no. These are the rules. It has to be abided by. So tends to be the ER nurses, probably the more high-paced areas. And again, that kind of goes along with personality. Certain nurses are made for certain areas, and that's why there's so many great places to work in nursing, because it's definitely not for everybody.
I just find it interesting because so many of us, and like you even said, you didn't picture yourself in corrections. So many of us would probably not intuitively think, oh, I should try out the prison nursing. Like, it just wouldn't be something that any of us would think about. But if you've got persistence and you're strong-willed and you've got what other personality traits would you say might give prison nursing a try?
Though truly, those are the two biggest ones. It's a strong-willed, strong personality.
Perfect.
And most of us that work in corrections now, we always laugh. It's like, did I really think I was going to end up in a prison? Never.
Right.
And I think the biggest thing is, and I get asked this all the time, aren't you terrified to be in there? And never once have I been afraid to be in there. I think it's just something you need to take a tour in a prison.
Wow.
Even if you start out PRN, which is how I did. I just was thinking about it for, some extra money, which a lot of us do.
Sure.
But I really like the ability to say no, not gonna lie. I think it's a lot of nursing, and I love this about nursing too, but we are taught they are the client and we take care of them in whatever way we need to. Here we take care of them, but in a completely different way. We educate, we teach them other ways around it. I have a formulary list of medications that I can use, and I have to pretty much use that, and it's basic medications.
Mm-hmm.
So, everybody that's in there has to be strong clinically. And the big thing is flexibility. I think that that's one of the biggest things that draws nursing to corrections is when they want flexibility.
That's awesome. That's good to know, because there's a lot of us that feel so tied to those 12-hour shifts at the bedside. And so this is why we do these Q&As, because I really want to get out there the word on the street. What else is out there? What's available to us? So yes, Emily says, I'm very happy you did this Q&A. I love working in corrections. And she also said that she feels safer in a jail than she does in the hospital. Another question came through from Sean. He says, are the inmates for the most part grateful for your care? And do you have a lot of autonomy?
Tons of autonomy. One big thing for especially my LPNs is all of them have told me they have way more autonomy working within the prison system. The way that our Nurse Practice Act here in New Mexico is written, it does give us the ability within corrections to give more autonomy to my LPNs. So it's a great avenue for LPNs. And nurses as well. As a nurse practitioner, I have full autonomy. I run everything. So that is huge. I apologize. I forgot the rest of his question.
Did you feel like inmates are grateful?
For the most part. Most of them are way more respectful than patients that I had in the ERs, or, we've all had those patients that, think that you're their maid at the bedside as opposed to your nurse. Most of my patients are extremely grateful, very respectful. It's always yes, ma'am, for most of what they're discussing with me. The young kids take a minute to learn the rules and the respect factor, which they probably need, not gonna lie. But they pretty much know that we're there to help them. They do get upset when they don't necessarily get what they want. But again, this goes back to being fair, firm, and consistent. And so long as you're fair, firm, and consistent, then you're pretty much they learn that those are the rules, and you're good.
So Rebecca, she entered this comment prior to the Q&A. She said that she's worked in a prison for 5 years and explains that as a nurse, you have a lot more autonomy than others. And so my addition to that was, would you mind, Tiffany, elaborating on what that autonomy is like from your perspective? What exactly are you doing autonomously?
Sure. So, for example, the big thing that the nurses do is nursing sick call. And they have standing protocols for almost anything. They can distribute medications off of these nursing protocols based on symptomologies. They're having GI problems. They have lists of things they can go through: Pepto, Imodium, Gas-X, things like that. So they don't need to pick up the phone and call me or whoever's on call. That's probably their biggest thing. Wound care, they do tons of wound care on their own. So long as everything is looking good, they don't need to call a provider. They just keep rolling with the punches. But again, being that, especially on the weekends, there is no provider on site unless somebody's coming in for an emergency. They do these sick calls. They basically get to make the decisions. And that goes back to their clinical skills. They need to have those clinical skills to determine, yes, this looks like a viral cold. I think this is okay. Or, hey, this guy's looking like he's got strep and otitis media. I need to call the on-call. The only time they really need to call us is if it's for a new type antibiotic order or new wound care orders. But for the most part, my nurses do it all on their own.
That's awesome. So I think you already answered this question, but maybe you have something to add. Dale asked the question, what type of medical backup do you have available?
So yeah, the medical backup, I mean, if we have a medical emergency, we will get responders from all the other sites that are within my compound. And so that would be up to like 10 other nurses or LPNs, and then a host full of techs. The correctional officers are also CPR certified, but since we're not an ACLS facility, the biggest thing is stabilize and call 911. We do have like emergency bags. We can get the lines going, get fluids going, oxygen. We can do nasal airways, oral airways, things like that. We have the AED, just no emergency medications.
Okay. Good. Let's see. Have you ever felt, yeah, I think you already answered this as well. How do you keep yourself safe? Have you ever felt unsafe?
Never. Security, you just have a good rapport with security and it works. And I truly am safer in prison than I ever was in the outside setting. I truly feel that way.
Yeah, that makes sense. How do the benefits and compensation, vacation time, that kind of thing, compare to a hospital setting?
So, one of the nice things about corrections is if you don't see them at the end of the day, whether it's sick call or it's provider or dental or eye clinic or any of those things, they're still there the next day. So at the end of the day, you can pass on what you need to the next shift and they can continue it. So one of the things,
personally, for you personally.
Right.
Oh, okay.
So, for me personally, that gives me the ability to leave when I need to leave when my shift, if I'm supposed to leave at 4:30, I am out the door at 4:30.
Gotcha.
I can stop seeing patients if, and many nurses will do this too. If, it looks like they're getting short on time and they still have sick calls, they'll roll them to the next day. So they get to get out. They get to get home to their families on time instead of staying extra hours, and me the same way because I have little guys. So we have definitely more benefits with regards to holiday time
Okay.
than the hospitals do. So Monday we had Veterans Day. That was considered a holiday. So any of my nurses that worked got time and a half, plus they get a compensation day that they can take within the next 6 or 8 weeks. So they will get a free day off. So that's a huge thing. It also gives us a little bit more ability on the holidays. We work a skeleton crew. And they pretty much let us work that out amongst ourselves. So somebody wants Christmas Day off. Instead of running 3 nurses, we only run 2 nurses, those kinds of things. So they let us have a lot of autonomy over that, and we all work it out amongst ourselves. So none of our nurses miss really major holidays, which is really nice.
That is great. That's a beautiful thing. Do you work shorter hours on the holidays? Like, do you guys split the shift and each work 6 hours, or?
They let us do it however we want to, and we have no call.
Wow, that's pretty cool. And healthcare insurance, how does that work? Is it better than hospital, or is it the same?
It's truly about the same. I've always been shocked because I've never thought that the benefits working in a hospital are great. You'd think it would be so much better. I don't think they're any better or any worse.
Okay.
Paid time off. It goes up as you've been there.
Yeah.
I think we start at like 8 hours every 2 weeks.
Okay.
And then, it continues to accumulate. But we're so flexible that you can trade your shifts around. You have a doctor's appointment or you have something going on. Our nurses just trade their shifts around amongst each other, and they're able to then work their schedules, and it's not too big of a deal. Probably 95% of my nurses have set schedules.
That's nice.
Yeah, they love that.
You do 3/12s, right?
Yes.
Okay, that's amazing. Guys, we've kept Tiffany longer than our standard 30 minutes. So if you guys have questions, please get them in, and I'm sure she'd be happy to answer them after the Q&A is over if she sees comments come through. So I appreciate your time. Thank you so much. I know you've had a crazy week at work, so I appreciate your time here today.
Thank you guys so much. And any questions, just write them and I will get you all an answer.
Thank you. And if I see them, I'll tag you if you haven't seen them.
Perfect. Thanks, guys.
Have a great night.
Y'all too.